if you're struggling with SI joint pain or instability, even if it's been going on for a long time, you can get better by doing the right things. Something about the SI joint makes it very possible to stabilize. It's shaped to be a very stable joint. I'm going to be sharing my strategy, what I used to get out of my personal SI joint pain and problems that I had. Just a little background. I have a personal history of SI joint pain and problems that lasted for a long time, definitely more than a couple years. Some of the symptoms I was having were popping and clicking in my SI joint. It was a sign of instability or movement, too much movement. Along with that popping and clicking, gradually what got worse was pain, to the point where I was basically bedridden multiple times over these years. The pain was excruciating. I'm talking lightning bolts of pain if I just tried to move my leg 1 centimeter. Over a period of time, I was able to stabilize my SI joint and get out of pain. So this is to give you hope if you're dealing with something like this. I currently do not have any more pain or popping or clicking. I don't have any signs or symptoms of SI joint problems after dealing with it for years. Here's my rehab plan in a nutshell. The number one most important thing in the beginning is for you to understand the problem. If you don't understand the problem, how are you going to fix it? The best, most valuable thing I did in the beginning was to understand the problem better. And that way I could take an approach to fix it without having to depend on going to someone else to tell me what to do. And you can do this in one day. You can do this in 1 hour. Sometimes it just takes a matter of something clicking, going, oh, okay, that makes sense. I get it now. The vast majority of SI joint problems are related to instability. When you understand the problem, then you can take step 2, which is to stabilize. And you have to understand the problem to do. One of the most important things about stabilizing an SI joint is to eliminate aggravating movements. How did this problem come to be? Part of it is the SI joint got aggravated and aggravated over time and eventually broke down. There's no point in doing the things that stabilize it or heal it if we don't stop hammering our thumb. The SI joint is so much dependent on ligaments for stability that largely this is a long-term process to get those ligaments to heal and tighten up and stabilize, and really it's going to be a long-term process. I've put out an entire video on the aggravating movements, but we will do a quick rundown of what they are right now. Here's the main things to avoid: hip external rotation stretches, deep squats, crossing your legs, most asymmetrical or unilateral exercises, or hip flexor stretches. But I'm not going to go through these in detail because I put out an entire video on that. It's called Stop Hurting Your SI Joint Stretches to Avoid. So remember, this is stage 2 of the overall process. First, we understand. Stage 2, we stabilize. Step 2 is to use an SI belt if needed and to the degree that you need. If you're in an extreme case where your SI joint's clicking and popping all over the place every movement you make, you definitely need an SI belt. Your pelvis is right in the middle of your body, and it's hard to do any movements without involving your pelvis. And if it's clicking and popping with every movement you do, you're constantly loosening up that SI joint when we want to stabilize it. Here's the SI belt plan. There's 3 stages. The first stage is to wear it all the time. If you're in this category that you're clicking and popping a lot or you're having a lot of pain, you want to wear it all the time. So stage 2 of the SI belt is wearing it during all activity, but not really during like passive things. So if you're walking, potentially, wear it. Activities of daily living like cleaning the house, yard work, whatever, wear it. But if you're just standing casually, you can not wear it. And then stage 3, you're going to wear the belt only during exercise. And this is a gradual progressive stage as well, because early on you're going to be doing more simple exercises, and later on you're going to be doing more, complex exercises, and you're going to want to be wearing the belt during the complex exercises later on, but maybe not so much during the simple ones. This is a slow process. We are trying to get ligaments to heal, and ligaments take time. Just like an ACL or an MCL, they take months to heal. And you have to brace the joint. You have to brace the ligament for it to heal. So that's what we're doing with the SI belt. Now, simultaneously with the belt and with the eliminating the aggravating movement, we're going to be doing stabilization exercises. And really, it's just one exercise. The bridge, which is the best SI joint stabilizing exercise that I know of, and it's highly effective. Was what worked for me and has almost 100% success rate in any patient I've given this to in reducing their SI joint pain. So why does it work so well? This is the bridge. We are contracting our hip extensors while simultaneously lengthening the hip flexors, which are a major culprit in SI joint pain. And the goal is to compress the joint. Look at these muscles. The direction of the fibers crosses the joint and pulls those SI joints together, just like the belt is doing. So we're doing that with our muscles using this exercise. And there is a modification to this exercise that I highly recommend and makes this, I would say, at least 10 times more effective. And that is strapping a belt around your thighs. And I just recently put out a video on that. I call it the SI joint stabilizer bridge. If you haven't gone to the Core Balance Training YouTube channel and we have a whole category called SI joint. Just watch those videos. And one of the video we put out very recently teaches this SI joint stabilizer bridge. And that video is right here. Instant sacroiliac joint pain relief. And I would be doing this multiple times per day. And yes, I would be wearing the SI belt while doing this. Potentially in stage 3, I would not be wearing the belt for this particular bridge exercise because it's not stressing the joint very much. So when we improve the fitness of muscles, improve their strength, their endurance, their overall health, what actually comes with that is something called muscle tone. And muscle tone is the resting tension in a muscle. And so resting tension is like just this passive level of electricity flow that's flowing through a muscle, even when you're not using it, even when you're sleeping. And so, yeah, doing core balance training, strengthening your glutes, improving the general fitness and flow of blood and electricity, into those areas of your body will help you even while you're sleeping. And now we're going to go to the next step in the process, which is reintroduce. Because if you only just stabilize and you've eliminated all these functional movements from your life, you're not going to be able to live a normal life. And the ligaments in the joint are not going to get stronger. The way that ligaments get stronger is actually by stressing them. Weirdly, but they have to be in a condition where you can stress them, and the stress has to be gradual and progressive. So reintroduce the eliminated movements gradually, very gradually. That's a key word, and this is a long-term process. So you're going to reintroduce something very light in the beginning, just like maybe a squat. Even though a squat isn't really that stressful, maybe you weren't doing a squat before, you were just eliminated all kinds of stuff. Start with something like that that's not very stressful. And then maybe go to a deadlift. And maybe at that point, when you've reintroduced those, then you could feel ready to reintroduce something like a lunge, which is going to stress the SI joint. That's actually the goal in this stage. And, you may be wondering, how do I know when I've reached this stage, reintroduce? How do I know when to move on from stabilize to reintroduce? It's really going to be a matter of how do you feel? Are you feeling pretty good? Are you feeling pretty stable? This phase might be 6 months long, or a year long, or 2 years long. Really might be the rest of your life, because this is going to be a learning experience too. There's going to be times when you reintroduce something and it backfires and it sets you back. It's part of the game. And if that doesn't happen to you, then you deserve an award, because that means you're a master of listening to your body. But this process of reintroducing is very long-term, very gradual, meaning one movement per week, maybe at the most. And if you're successful with that movement, then the next week you introduce another one, but definitely only one at a time. If you reintroduce 2 movements at the same time and then you get irritated, you're not going to know which one it was. So only one at a time, and then know when to stop. And what do I mean by that? You probably shouldn't reintroduce every movement that you were doing before, because something about that lifestyle, those activities were what led to the problem in the first place. I would say the vast majority of people don't ever need to do the pigeon pose in yoga. So know when to stop means, how is your life going? Are you able to do the activities that you enjoy in your life? Because that's the real question. And will reintroducing the figure 4 stretch add to your functional abilities in your life? And if the answer is no, then you probably don't need to reintroduce it. So single leg bridge would come in the reintroduce phase of SI joint pain. It is stressful on the SI joint. I currently do the single leg bridge, and it's beneficial for me. It does not hurt me. And so there is a point where you can get to in SI joint stabilization and reintroducing where you should be doing this single leg bridge. So it's all going to depend on where you're at in your SI joint journey. And for example, you do the single leg bridge and it increases your pain, then that's a definite answer for you. Don't keep doing it. You got to do some more stabilization. But there's maybe one side of the single leg bridge that you can do without pain, and that might help to restore the balance in the musculature where, you may have something like this going on. So if you have this going on, I would be doing the single leg bridge on with the right leg down, this leg down, and that would help restore balance in these muscles. So if you can get away with something like that without hurting your SI joint, then that might be beneficial for you. This is my overall plan, and it's first understand, then stabilize the joint. And then you have to, in a calculated way. So this reintroduced phase is calculated, it's progressive, but it's very slow and gradual. It takes a lot of patience. You have to do that in order to stress the ligaments. But if you, say, stress them too much and too big of a jump of stress, that potentially will break them down. So the stress has to be a little bit each week, just a little bit more, so that those ligaments heal stronger than they were before. And the only way they can do that is through stress. If you don't pull tension in the ligaments at all, then they will be very weak. They will never learn to resist tension. Prolotherapy can be used anytime in this process of the rehab plan. You have to be doing the right thing though. If you haven't started doing the right things or eliminating the problem, then there's no point. You're just wasting your money with something like injections. Having a plan in place, and not only that, but having hope is really needed. If you're struggling with SI joint pain or instability, you need to do the right things for a long enough period of time for the ligaments to heal. But it is very possible. And so if you give it what it needs by following the step in the plan laid out today, there is so much hope for you to not only get out of pain, but to be able to get potentially stronger than you were before. We appreciate you here at Core Balance Training for leaning into your health, and we'll see you again next week.